Hello and welcome to Connect and Collaborate. I'm Alex Hopkins, your on-air producer. And today, the state of Colorado healthcare systems are plagued with inefficiencies, poor to no communication among various healthcare disciplines, and a lack of understanding the roles in various disciplines play in the part of caring for individual patients, their families, and the communities in which they live. The MSU Denver Health Institute will go far beyond what most academic healthcare program institutions teach. And here to talk to us about that institute is Dean of Professional Studies, Dr. Jennifer Capps. How are you doing?
I'm doing great. Thanks for having me here today.
Yes, my pleasure. So as you know, healthcare overall, legally, legislation speaking, is a mess. The profession itself is pretty hard up for new nurses, doctors, things like that. And we have a lot of systems that are in place. As you mentioned, you and I were talking off air. We have a lot of programs and we have a lot of interest. But somewhere along the way, something's breaking down in the industry that we need more technology coming out.
There's all sorts of issues. I think that there's a lot of people who are generally interested in working in the healthcare field, but we have some misses. The healthcare system is too expensive. We spend 18% of our GDP on healthcare, and it's not sustainable. And most of the time, people that pursue healthcare and want to be seen, it's very, very hard to get there. Everybody has an experience where they got this weird bill or they couldn't get an appointment that they wanted. So we really need to be able to modify and change that. We also lack a lot of diversity in healthcare. There's a lot of research to demonstrate that the more diversity you have in healthcare providers, the better outcomes we have for patients. And that's particularly lacking in leadership positions. The other big thing is we're really, really lacking, and we have a lot of shortages around things like nursing, behavioral health, but also around allied health positions. And so one stat I like to use is for every physician, it takes 16 people to support the work of a physician. So 8 on the clinical side and 8 on the non-clinical side. So MSU Denver really aspires to be about that other 16.
Awesome. I think it's one of those things when you're a kid, you think of only like 3 professions when it comes to healthcare: doctor, nurse. Sometimes you think of a psychologist or psychiatrist. Sometimes you think of a dentist or a vet, right? There's limited careers that you think of and that are introduced to you as children.
Absolutely.
Yeah, and so 16 people per physician.
Yes.
Is what is necessary. That is a number I've never heard.
Yeah.
But an exciting one, because this opens up so many job opportunities. And we're not talking the minimum wage workers. We are talking significantly paid positions.
You bet. So all over the place. So radiology techs, physician's assistant, emergency medical technicians, all across the gamut of positions. And what we find at MSU Denver, being a modified open access institution, where we're in an institution that defines ourselves by who we include, not who we exclude, we take everybody, and we are the place of opportunity. And so when students come in and they express an interest in wanting to work in healthcare or wanting to help people, they often need a little help in figuring out how to do that. And what's great is that aligns very well with, once they start to learn about all of these positions, they go, oh my gosh, I never had any idea I could be a radiologist or a tech. And since over 85% of our students work, there's great opportunities for partnerships with health systems where students can work in some of those entry-level positions while they're pursuing their degree, and then have a great pathway into a position and elevate through the health systems here in Denver and Colorado.
Fantastic. I love hearing that. We know a little bit of the why MSU Denver is getting involved in this bigger overall problem. But before we get more into the program itself, I want to hear about your background.
Sure.
So I mentioned you are the Dean of Professional Studies, and that is more than just the Health Institute.
It is. The College of Professional Studies is a large college. It includes a lot of the health programs, but it also includes a lot of the innovation and STEM programs, engineering, industrial design, advanced manufacturing, to name but a few. And actually, it's sort of a match made in heaven, because if you think about the advances in technology in health, if you think about simulations and the use of computers to image for surgeries and procedures, that connection between technology and innovation, like our industrial design program, matches very well with our healthcare industry. So we have great partnerships in that way, and there's great potential to expand those even more. I've been the dean. This is my third year. Previously, I was a professor in the criminal justice department at MSU Denver, which could be kind of like, why is she doing this stuff with health? My background is as a psychologist. I have a PhD in counseling psychology, and I was the person that really worked on the intersection between juveniles who did really bad things and how to rehabilitate those kids. So I did a lot of work in that and had the opportunity to do a lot of interdisciplinary collaboration with the state, with behavioral health, and lots of other entities. One of the most impactful positions that I had was working in an emergency department locally for about 8 years. And so I worked in the ER. I was able to do psychiatric assessment, trauma assessment. I unfortunately was there when the theater shooting happened and responded to that crisis, as well as many other things. So, but it really gave me the inside knowledge to see both the strengths of our healthcare system and how people work together and where those holes and those gaps are.
Yes, which is amazing to hear. First of all, thank you so much for your work. The emergency department, I don't know if anyone's ever really sat down and been able to watch. I mean, typically people are in a lot of pain when they're in the emergency department as patrons, not as workers. But there's a lot of work that goes into that, and it's exciting to know that you have that background. One of the things that I talk on Connect and Collaborate a lot about is workforce development. And are we bringing the right people to the table to talk about this?
Right.
Yeah. So you saw those gaps.
Absolutely. And so what's interesting, and one of the pillars of our Health Institute is really about collaboration and interdisciplinary collaboration. And so as many people know, training in the healthcare industry, training to be a nurse or a physician's assistant or any of the number of positions, they're highly standardized and accredited. And that's important, because you don't want a nurse that doesn't know what to do. That would be scary. But at the same time, those positions need to know how to interact with one another. And where I saw the best medical care teams is when a nurse knew how to talk to a physician, who knew how to talk to a billing person, who knew how to talk to a radiologist. So training from the beginning, and that doesn't often happen. And so that's really what we aspire to do. And so when we put forward our simulation labs, we're bringing together the social worker, the nurse, the nutritionist, and the dietitian all together and simulate different scenarios and figure out how from the beginning they can train to provide the best care.
That's amazing to hear. Across industries, we see silos all the time. And I guess I never really thought about one in the healthcare system personally, because I see nurses talking to doctors all day. But as you mentioned, the bill paying, the radiologists, there's many different entities that go into this. So I have to ask you, in this program, you make sure that you're immersing these students in all of this, right? So we're treating this more as a real life, day-to-day job rather than just learning, sitting in a classroom. Of course, there are elements of that, and you're going to have that.
Absolutely.
But that being said, is there a potential here for students to be a little bit overwhelmed? Because not only are they learning the technical aspects of the job, which in and of itself is something I could never do, but it's tough. I have several friends that have been in nursing, and I've watched them, study for finals and things like that. So you're learning the technical side, but you're also having to make sure that you are working on these soft skills, so to speak, so the communication. Is it a chance that we're overwhelming students, or is this actually a better thing?
Well, I think the soft skills, and I relabel, someday I'm going to write an article, soft skills to me are essential skills. So those aren't the technical skills, and the essential skills of knowing how to talk to people and collaborate and move forward to provide the best care are super important. And I think they're both essential for good care. And I think one of the pillars of our Health Institute is around health career navigation. So really to address what you're talking about, because it can be very overwhelming. These aren't easy careers, but we want to make sure that those standards are in place. So we have a number of programs that support students in a cohorted model. We assign them what's called a health career navigator. It's their person that helps support them, assigns them a mentor, provides them very significant advising and support in terms of family support, social support, making sure the career is a good match for them, financial wellness, health equity, all the stuff that they need, and then also to find them additional monies going forward to support their education. And that has been incredibly successful for our health students. And it's very interesting because they get a scholarship to be participating in this program. But we had one student, Kyle, who said, it's awesome that I get a scholarship, but I'm so glad I have a person to help me. That's the biggest difference maker for me.
Yeah.
So you're 100% right. And what we aspire with the Health Institute is to have every single student have one of those health career navigators. Right now, we have 6,200 students and about 100 students in the program. Yeah. So that's where those are really big opportunities for our health system partners to engage with us. And we're in communication with different health systems to say, hey, do you want to sponsor a cohort of students and help them to have a health career navigator help support them through? Because it's more than just a scholarship. It's that advocacy and support.
Absolutely. And I would say that right there is probably the biggest difference that MSU Denver is making compared to other institutions. I have to agree with you on that. I would have much rather had somebody, quote unquote, hold my hand.
Absolutely.
Through schooling than making sure I got everything paid for. Now, I do have to say, as we know, cost of secondary education is it continues to skyrocket in every industry, no matter what major you have. Yeah. And you mentioned that we need more technology when it comes to the healthcare system. So talk a little bit about this cost. We know that we've got the scholarships, and we will talk a little bit later about how businesses can get involved and help with more scholarships along the way.
Sure.
But is this making a bigger dent in pockets, or is this actually coming out a little more even keel?
The inclusion of technology in health?
Yes, sorry.
Okay. Yeah. No, that's okay. I think we aspire to include even more technology, and one of the biggest areas that we see is simulation. And so I'll give an example of nursing and the nursing shortage, and I think I can answer your question in that way. One thing that we know all too well is we don't have enough nurses, and it's not a question of people being interested in nursing. We have lots of students that are interested in getting into nursing programs. Where we fall short is providing the clinical opportunities for nursing students to be trained. And one way that we can affect that is through simulation, so providing through technology opportunities to replace about 50% of that clinical time with simulation. But that technology is expensive and requires a lot of standardization. And so we really need to invest in that technology because in many cases, providing students opportunities to simulate experiences allows for you to create problems for them and to do do-overs. For example, if you have a nursing student that has to be a part of labor and delivery of a woman giving birth to a baby, well, you can't really plan that, right? It's going to happen, and it's going to happen how it does. But in the case of simulators, you can do a breach. You can do all kinds of things to create problems and see how the students respond in a very low-risk situation. So that's the way forward, not just popping up a bunch of more programs, but how can we, as different institutions, both other academic institutions as well as health systems, work together to solve that problem. So the other piece around technology is the use of animation and computers to be able to also train students. We have a lot of engineering students who kind of fall in backwards into these opportunities in health and simulating surgeries. The technology is amazing. If you were to go in and have your hip replaced, it's all simulated through digitally through computers now. And so how do engineering students and industrial design students get trained in that? Well, they don't really.
Yeah.
And so we need to bridge those gaps. So I think there's lots of opportunity.
Fascinating.
Yeah.
You took a route there I didn't even see.
Yeah.
That's awesome. And you're right, though. We need to be more vigilant about making sure that these paths are crossing more and getting involved with other entities, other industries. Because eventually, with technology, we're going to have crossover a lot more than we've ever seen before. And so we're in an exciting place, I think, personally. But to see that the healthcare industry is really benefiting from technology.
And I think, one thing I'll say is that I think people assume technology is taking jobs away, and it's actually just creating different jobs.
Exactly.
And that's the big misnomer, I think, that happens.
Yes, I will agree with you on that. This is the theme that I have had in here a lot lately, actually. We keep talking a little bit about your pillars. We mentioned one, that's that health career navigation. So you do have 6 pillars that are involved for the Health Institute. Do you mind talking a little bit about each one of those? And we touched on them, but
Absolutely.
But they're important.
Whole person approach to wellness, that's a big one. So what that really encompasses is all the things that you can do to prevent illness. So 80% of illness, things like cardiovascular disease, stroke, type 2 diabetes, 80% can be intervened or prevented through lifestyle choice. So exercise, nutrition, stress reduction, behavioral health care. 40% of cancers can be impacted and prevented by such care.
So you're saying exercise and diet still, after all these years, have the biggest impact on our health.
Absolutely.
Okay.
And so what we've done is put forward the first undergraduate degree in the nation called lifestyle medicine. And what that includes is it's an amazing degree, and we just had our first graduate of the degree, Nancy, who's a Native American student and is actually bringing back what she's learned from the degree back to her rural community. And it's an amazing thing. So she feels like it very much aligns with her Native American culture and the principles of healing. But what the lifestyle medicine degree does is it teaches students about the value of exercise, nutrition, all the things I just mentioned. It also provides you the background to be able to sit for a wellness coaching certificate, so you can be certified as a wellness coach. And then third, it allows you to meet the criteria to sit for a patient navigation certificate. So patient navigation is a big thing these days. And so there's a lot of positions open and available for in different health systems to help you and me navigate the healthcare system. So it's a triple threat, and it's a phenomenal degree that also prepares you to be very competitive for graduate school and medical school. And so being first in the nation, we're very proud of that. I think the other big thing is around our focus on industry partnerships. So you had asked a question, how are we bringing the right people to the table? So before we embarked on this idea of a health institute, what the heck is that? A bunch of people just getting together and deciding we're going to do something in healthcare? No, we spent the last year meeting with over 100 different industry partners and asking them what they wanted, what they need in their health system, what their patients need. We asked community members, we asked students, we asked our faculty experts. We held these things called Health Salon Series, where we got together experts in the field, sat down with them, and picked a topic. So we picked health equity and diversity in healthcare, technology, the cost of healthcare, and really got the best in the business to really help to inform how we should move forward. So we're really proud of that as well. The last thing I'll mention is about culturally responsive care and culturally responsive curriculum. Health equity is so important in our community, and in healthcare, it's very clear that if you have money, then you're going to get better care. And if you don't have access, and that really hits our diverse communities more so. And being where MSU Denver sits, we're in a very unique location. We're 2 steps away from Lower Downtown, which is an amazing, thriving community. And we are a couple steps away from communities like Sun Valley that are really struggling to get the support that they need. And so we're partnering with different communities to make sure that we're advancing the work of health equity and making sure that all communities get access to healthcare.
That is wonderful. I love that you guys really sat down with some industry partners. You had this conversation. You thoroughly thought this out before you implemented this program. And that being said, I was under the assumption that this was a program that you could enter into and it's just enrolled, but I was wrong about that.
Good.
So it is students that are already going into healthcare professions.
Yeah, so it's an opportunity to take all of our 10 different health departments and majors, which represents over 6,200 students at MSU Denver. So it's about a third of our total enrollment, a little short of that, and putting together collaborative ideas to move forward health in the state of Colorado. So how do we prepare our students to be the best worker at Children's Hospital, at Denver Health, at DaVita? How do we impact communities? How do we bring down the cost of healthcare and improve wellness in the state of Colorado? And if you do have to go see a physician, to make sure that that experience is better.
Yes.
One of the number one things that we heard from industry partners was they really care about their employees, and they really want to create pathways for their employees to advance within health systems. And so what we've been really working on with a number of different industry partners is saying, okay, where are those areas that you need to provide opportunities for advancement? And so we're working with a couple different health systems about creating pathways for their existing employees to take some of the experiences that they have on the job, pairing them with the associate's degrees that they have, and creating a path forward for a bachelor's degree. And so that's going to allow them to advance within their institution. It allows them to also work with us, and then we can provide them the support and resources. And what's great is that tends to impact the most diverse employees and really elevate and allow for upward mobility. And as most health systems know, being able to advance workers within the health system is much more cost effective and provides better care for our communities.
Fantastic. And speaking of our communities, one of my favorite things about MSU Denver overall is that 95% of your students are from Colorado, and 80% of your students end up staying in Colorado after they've received this education. So people that are worried that they're going to get this amazing education and then flee from Colorado and take that talent elsewhere, although we're not opposed to it, we do like to keep our talent here in Colorado. So it's exciting to know.
Absolutely.
Yeah.
Absolutely. And with you stole my line. That's absolutely true. The other great thing is, like I think I mentioned before, almost 90% of our students work. And because there's these lower level positions within health systems, these kind of lower paid jobs, but these more higher turnover jobs like CNA, certified nursing assistants, and those kinds of positions, our students are working. And so what we're really trying to do is help support them to move into these positions while they're going to school. It fills these workforce needs with health systems, gets them the experience within the healthcare system while they're getting their degree, and then they can move on to kind of the next thing within that health system. So it's kind of a win-win as we partner with industry to have our working students work in these health systems and then work together to create a good path forward.
Yes. Wonderful. And we have touched on it quite a bit, these industry partnerships. So we know that you had industry partnerships going into this before. You wanted to have a very thoughtful process about creating this institute. But I imagine that there's space for other businesses to still get involved.
Absolutely.
Yeah.
Absolutely. And so we're going to continue to have some health salon series. And so we welcome anybody who's interested in partnering and collaborating. We have a great, so people can contact me at any time if they're interested in getting involved. I'm still meeting with people weekly in terms of different ways to partner. We love when you hire our students and provide internship opportunities. If you're interested, we have a health careers fair that's in February. I know that's a little ways off, but to be represented there is a big deal. We're also really excited to have, we're sponsoring an event. Dr. Samson Davis is coming September 26, 2019. At 2 p.m. at St. Cajetan's. He wrote a number of books, including Living and Dying in Brick City. He's a physician, and he's coming to speak to our campus, and we invite anybody that would like to come.
Fantastic. Well, I have learned a lot today from you, Dr. Jennifer Capps. I appreciate your time. Definitely click on the link below here on our YouTube page. You can find out how to get in touch with Dr. Jennifer Capps, as well as all about the Health Institute. Be sure to like and subscribe our YouTube page while you're here. You can find this podcast and more at cobrt.com/radio-podcast. Thank you so much.
Thank you.